Hello again, I'm Joel Barthelemy. I'm old enough to remember when a cell phone was only a phone. Now, these things have become as essential as shoes because we can do so much with them and we feel lost without them. And there are thousands of apps for virtually everything involving healthcare. In fact, a number of companies can bring a doctor to you on your phone for a fee. Using a video conference program like Skype or FaceTime, you see and speak to an online physician you've never met. Provide the doctor with your symptoms and receive a diagnosis and treatment suggestions. On the surface, it sounds simple enough. In most cases, you confirm what you probably already thought was wrong with you, and the doctor suggests the usual treatment. But the money spent is often worth the peace of mind. Before you make that call, however, the Citizens Council for Health Freedom suggests you answer 5 questions. First, who owns the data of your conversation? Asked another way, who has the records of your telephone visit? For continuity of care purposes, the online company should report the medical visit information to your primary care physician. Number 2, if you do use one of the online services, is it wise to move the medical decision-making away from hands-on patient care? Well, you might ask, isn't that what happens in more traditional telemedicine visits? There are some similarities, but the biggest difference is that a lower-level practitioner like a nurse or well-trained medical assistant becomes the hands of the remote physician in a regular telemedicine visit. For example, the doctor tells the patient presenter where to place the stethoscope or an examination camera during the exam. Question number 3, will you talk freely if you know the conversation is recorded? And how long, if it is recorded, will it be kept? During a traditional telemedicine visit, pertinent medical images and vital signs will be saved, and the doctor's impressions, they will be saved to your medical record. Rarely is the video conference itself ever recorded. But the online healthcare company will likely record your entire interaction between yourself and the physician, and they'll probably retain it for years. It's the easiest way that company can prevent legal problems. So everything you say and how you say it will be on that recording for years. Question number 4, will telemedicine lead doctors to more readily follow government treatment directives because they feel less connected or responsible for the patient? You know, most physicians already feel a duty to all of their patients, even though seeing these people online for the first and probably the only time. So no, I don't think this is an issue. I've saved this question as question number 5 because it's the most interesting. Will doctors call the police if the video they're watching of you captures something suspicious taking place in your home? Certainly an undressed family member photobombing you might be cause for an embarrassing moment, but I don't think it would result in a call to 911. The real question here concerns any activity that a physician or other healthcare provider has a duty to report to the police. Even though the activity may be entirely innocent, if it looks like child abuse or domestic abuse to the physician, you might have a problem. My suggestion? Make the call where you have some privacy away from the potential distractions. One final caution, these services are for less serious healthcare problems. They can't resolve unfamiliar chest pain, difficulty breathing, numbness, or dizziness, you should seek immediate health care at an emergency room or pick up the phone and call 911. Thanks again. I'm Joel Barthelemy.